Welcome to Medical Confessions.
Your remedy for serious medicine. I'm Jen.
I'm April.
And I'm Scott. Today we're going to be talking about how pregnancy tests work and if men can test positive on a pregnancy test. And we might even talk about the youngest person to ever get pregnant.
I don't know how much experience you have with pregnancy tests, Scott.
Zero experience
Zero.
whatsoever. Well,
I think
for me personally, zero. For
you have 3 kids.
I have 3 kids. At some point, there was a positive result.
The technicality of the, administering and all that may not have been in your forefront. So I think April and I both have probably been there. Maybe different experiences, because I think at times you want it to be positive, and then there's other times you don't want it to be positive. So.
Well, so this brings up a good question on camera in front of the world. When you did test positive for the first time, was it a crap or a yay?
It was crap.
I knew that about April. So, and mine was we were surprised with our daughter, but it was a good surprise. We weren't, we would always hoped, but we didn't think it was going to happen. So it was exciting for me. So it was different. It was, Yeah.
Mine was definitely a crap. Now I need to get a job.
Yeah, different times in people's lives, I suppose. So let's talk about how exactly do pregnancy tests work. I know from, just the user standpoint, I know if you read the box, it says you need to wait, was it like 6 or so days before you're going to get a complete. I know you have to do it like first thing in the morning is typically like when the levels are highest, right?
No.
Okay.
Did you know
I
that?
didn't know that.
I know early on that that's the case, and then once the HCG is higher, but I don't know exactly.
Well, before we get into it, we have pregnancy tests here. We're going to test it here on camera. Do we want to put that first? Because these take time, right? How long does it take?
Just like a minute or something.
Couple
Right.
minutes?
Well, I think it says like 3 to 5 minutes wait, but I know when I took mine, it was instantaneous.
Instant,
when I was pregnant. But then I've taken them before where I wasn't pregnant, and it took a while for the results to show up.
Oh, well.
Interesting.
Do we want to dip our pee sticks? We each have our own urine here on the table.
And as topics suggest, even Scott could potentially have a positive pregnancy test.
Let's hope not.
So,
Let's hope.
yes, men can test positive on a pregnancy test. Let's just
Start with
spoiler alert.
So we'll do that, please.
So
no
let's test our pee.
splashing.
No spilling.
And it has nothing to do. Men testing positive has nothing to do with
Being pregnant.
being pregnant or like.
Okay, so
what,
how long do we have
seahorses.
to hold it in
'Cause
there?
I don't know. You guys have done it before.
Well, I think it was just like under a steady stream of urine.
Yeah.
So I think it just has to absorb it, and then
When you guys took the test, did you spill everywhere? Or
no, like you
it was a
just
pretty
sit
cleanly
and pee.
process?
You
Yeah.
sit and pee. So you hold it under the stream.
Well, I feel like this soakage
That's
should be
probably
enough,
good.
right?
Yeah. Then cap it over so we don't get it on our table.
I hope I don't have another crap moment.
God, I
Well,
think
just for the record, I cannot get pregnant, so I'm pretty confident in my results, and
I'm pretty
okay.
sure I had asparagus recently. Ugh.
another day, another topic, another topic. Okay, so let's not look at them right now.
All right.
So, how exactly does this work?
So modern day pregnancy tests actually test for the presence of a specific hormone released by placental cells about, like you said, 6 days after the egg gets implanted. There's a group of cells called trophoblasts inside your uterus that release human chorionic gonadoprotein.
The gonads
Or,
again.
sorry,
Back to the
gonadotropin, sorry. Human chorionic gonadotropin.
Okay, and
It's a
I've
tough word.
never been able to
HCG.
pronounce it. I've always called it HCG. Okay.
Let's call it HCG. So that's all this is testing for, is that presence of that. So if you have that in your bloodstream, which your uterus is going to start secreting about 6 days after the egg gets implanted, then you're probably pregnant. The HCG levels, well, actually, once you do become pregnant, they'll double every 48 hours, the levels of them, and they peak somewhere around 11 to 12 weeks. You're smiling.
I just am having a hard time not looking at the results.
I'm distracted because there's a drop. It's from the lid. So,
You got a pee
anyways.
drop. Oh.
Anyways, carry on.
Sorry.
So yeah, that's what the pregnancy tests are testing for, is just that protein. There's an antibody in there that they actually use. They call it an immunoassay that will attach to that HCG molecule, and then that immunoassay they actually either use a molecule that can fluoresce or some sort of dye. So if it does attach, that dye will then show up on the results, and now yay, you're positive, or crap, you're positive. Either way, however you want to say it. But it's pretty simple, actually. Blood levels of HCG are actually pretty close to urine levels, which is why it's much easier just to pee on a stick.
Okay, well, so going into the doc, it's not a, like I know a lot of people go in to get validated or get it confirmed, but really it's not that much more accurate than doing your test
It's the exact same test. I'm pretty sure doctors order it in bulk, but it's the same test that you order. It's the same thing, and they can double check with your blood, and there's a couple of other hormones they can test for to make sure, because as we'll find out, certain types of cancers can release HCG. People dying of liver failure actually have high levels of HCG.
Both male and female.
Yeah.
Oh wow. Okay.
So just because that's the only thing doesn't necessarily mean you are pregnant, which is why it's that 97 to 99% accurate, and sometimes there is a false positive because you've got something else going on, but that's pretty rare.
So when did the pregnancy test come about? Like
the first pregnancy test?
Well, I did some homework, and I saw that, Egyptians had a method, was it 1350 BC or some craziness?
It was 1350 BC. Look at you.
I did do my homework. You didn't think I did, but I did. And so there was some more, archaic or,
Actually, and way back then, their pee test was pretty accurate, about 70% accurate. What they would do is take women and make them pee on wheat and barley seeds for several days, and they'd see if they'd fertilize. And their thought process was, if the barley grew, you were going to have a girl. If wheat grew, you were going to have a boy.
But if nothing grew, you weren't pregnant.
I don't know on that one, actually. I think
I read that, and I couldn't figure out what the negative result would be.
Well, and I think they were just testing for, they took a pregnant person and said, are you going to have a girl or a boy? And that was the first.
So it's more of a gender.
It's more of a gender test.
Gotcha.
But in 1963, they did studies to see if that worked, and it actually does about 70% of the time.
Well, that is like really super. And so this is funny. We just planted all the grass around, our house, and my husband's going to be so mad. So
you peed on him?
He was purposely going out and peeing at night on our grass because he peed one night and the next day it was super green. And so he was going out at night and peeing in spots that were not flourishing. So now I'm like, Dave, do you have something to tell me?
Do you have something you want to say?
Why are you fertilizing our grass with your urine? Why is it working?
That's what I've heard, that men, if they pee on mole holes, it will make the male moles go find someplace else to be.
Oh.
I don't know if that's true or not.
I think we've heard that. I think my husband's tried that too.
I tried it just because it was fun to pee on the mole holes.
We have mole problems, so yeah. I don't know.
Or maybe he just doesn't have high levels of testosterone.
And that's why he's fertilizing the grass. I don't know.
His finger digit ratio is not as good as yours.
Clearly. You have to watch all of our podcasts to get a lot of this, so...
all right. Has it been long enough? Can we?
I think so. Negative as suspected.
I do not have testicular cancer.
Pretty exciting.
Wait.
April. Oh shit.
No.
That looks positive.
Let me see it.
I think it's a false one. Give me that one. Give me that one.
Are you kidding?
April, that says you're pregnant.
And for the record, we all did our own urine here.
We did pee in our own cups. It's a light blue.
Is it clear?
It's
not
blue.
clear. That could not be. That doesn't look, because is this
no,
line supposed to be?
The blue line. That's the you're pregnant line. That's the you're not pregnant line. Your pregnant line.
Not.
That's a solid blue.
Well, hold on. Let's. Okay.
Okay, first, before you do it again.
That's awesome.
Let's back up. Okay, so the question.
So we had to take a little break. Sorry. One of us tested positive on our pregnancy test. We need a retest.
So for clarification, I've had a hysterectomy. Mine is negative, as would be expected. I don't know if,
I clearly don't have testicular cancer.
I think it's a false positive because your guys' lines are clearly blue, and this
Well,
line
Is not very
Well, that's
It's
not
not
the you're not
very-
pregnant.
I
This
know.
is the you're pregnant
But
line.
I'm
here,
just
hold
going
on,
on
hold
that.
on,
I'm
hold on.
banking
My
on that I'm not.
knowledge is each test, and I remember this when we were trying to get pregnant with our second son. There's only so much ink or whatever dye in each test. So when you are very pregnant, the blue will go to the other one, and the control line disappears. So that does not look like a false positive. That to me would be like a glaring. So
Yeah.
take the next one.
Well, I want to actually pee on that one. Like, not use...
Do that.
Yeah.
Not use your pee.
So when I
previous
have
pee.
to use the restroom again,
Okay.
I will actually
Can
do
you
it
focus?
Because you
correctly.
think there's something in there, like
Well, I don't know. I just want to make sure.
Well, and these plastic cups, I have to admit, these are not like sterile medical grade cups. These are from a
Well, I'm
Mexican
pretty-
restaurant.
well, I'm pretty sure the Mexican restaurant isn't spraying HCG because
I know.
all these are testing for is HCG.
Okay, so what else could create a false positive with pregnancy tests? That's a great question.
Unfortunately, certain types of cancers can do it. Cancers of ovaries, stomach, liver, dying of kidney failure. You don't have any
Clearly
renal
not
problems
that.
because clearly you peed just fine.
Although April and I did notice that both of our pee had some cloudiness, and so
Oh.
we were a little bit concerned about that.
I'm pretty happy you came up positive. I don't know why.
Yeah, until she has ovarian cancer.
yeah.
Oh,
Well-
now I feel like a.
So-
I don't know which one I would, like, feel more relieved about.
likely. So our question now, this turned into the April show.
This definitely turned into
No,
more
let's
of an
just
episode.
move on. We'll keep...
Okay. Okay,
Well-
so
Well, so let's just talk about the specifics. So HCG 6 days after the egg implants. It'll double every 48 hours.
Stop talking.
he's giving you a lecture. Next thing you know, he's going to be talking to you about like same-sex practices. And do we need to talk about
Go ahead.
prophylactics and like
Are you able to focus? Are you
next
really
episode?
just
Yeah, I'm
totally-
focused.
How birth control works.
I think I am betting.
It's
So
a false
first
positive.
question: are you and your husband trying to get pregnant?
No.
Okay, so
Are
this
you
would be
not
a happy
trying to
accident.
get pregnant?
This would be what?
A happy accident or a?
I would be pretty freaked out. Like, my son is, he's going to graduate in 2 years. And my plan was not to start over. But again, I think it's a false positive. Or
Okay.
I have something tragically wrong with me.
Okay. Are you on birth control?
Yeah, I have an IUD.
Okay.
Okay.
Oh.
So, I've totally lost my train of thought. So yeah, cancers is the biggest one, and kidney failure is another big one.
That's how it works.
That's all that's popping into my head right now.
So if let's remove ourselves from the drama that's unfolded, will a female or whoever, let's talk about standard pregnancy, will you test positive throughout the pregnancy? Does the HCG remain?
It does peak weeks 11 and 12, and then slowly goes into a steady state, so to speak, but it is
Yeah.
a lower level. So you can get more false positives later on, or excuse me, more false negatives later on,
Okay.
because the HCG levels are lower, but these tests are pretty sensitive enough to be able to detect it anyway.
Yeah. And I'll have to research it again, but I was under the impression when we were trying for our son, I was always told to try with your first morning urine or FMU or whatever it was. It was always like your first,
Yeah.
because your HCG will be the most potent in the morning.
Well, and I don't know about that. I've never read anything that says it's you're going to be more important in the morning or the evening, so maybe that's true.
Yeah.
I don't know. I just know that the blood tests are almost spot on the same as urine tests as far as the levels of HCG goes. And I can't get my head off of this positive.
April's fine.
Yeah. Get over it, Scott.
It's none of your business.
Yeah. This is
It's
not
her
what this
body,
episode's
it's her
supposed to be
body.
about. So yeah, I don't know about that, if it's better in the morning or not.
Yeah. And then and we led way to this earlier, so then explain why would a male then with certain cancers test
So
positive?
testicular cancer, about 50% of testicular cancers actually release HCG just as part of the cancerous the cancer process. And then there's other types of cancers in your body that can also elevate those levels as well. The purpose of HCG is actually to just engorge the lining of the uterus to make it better for the placenta to attach. You get more nutrients back and forth. But there are other things it can do to your body. It can help release testosterone. There's some people that say that it's good for weight loss. There's like a diet about HCG.
I've heard that.
I don't know.
I read something about that and looked it up because I actually know 5 people that had done 4 of them did the injections. 1 of them did the drops. There's under the tongue drops that
it
you can do.
It just seems so strange to take the, you think about pregnancy and, women being heavier and like it just seems, contraindicating for a diet to take the pregnancy hormone.
Well, and what I read is that it's been proven it doesn't work. All the people I knew drastically lost a large amount of weight. I mean, the smallest I'd ever seen them before in my life.
Yeah, but was it?
But I think, now my theory was, they're only eating 500 calories a day.
So it would have worked no matter
it's
what.
a calorie-restricted diet.
Right. So the first 2 days, according to this medical center, is the first 2 days you gorge yourself on high-fat foods of 300 to 400 calories a day.
I'd like to start that diet every day.
and the reason for this is they say also that you need to have that many because later on in the week when you're restricting your calories, you're going to be more lethargic. Because you're only
basically
consuming
give you lots
500.
of fat so that your body can then turn it into calories later.
Apparently. And then from day 3 to 26, you'll start the injections and then the 500 calorie a day diet.
Yeah, I would call that a calorie restriction because National Institute of Health actually warns against it. There's lots of side effects and bad side effects you can get from too much HCG. Most of them mirror pregnancy symptoms, breast tenderness,
mood swings.
But I know bodybuilders take it because it does, help release testosterone. And so if they're taking steroids, they like to,
potentiate
it with some HCG, which is bad for you because steroids are bad for you. Anabolic steroids. Well, actually, even corticotropic steroids are
not prescribed by a doctor.
Yeah, not awesome. But so don't take steroids.
Scott is clearly not a steroid user.
Clearly. Me and this guy here, we don't take steroids.
So here's another question for you. This is probably not a great idea, but I'm thinking we talk about the high cost of healthcare, and especially for younger males. I know of one gentleman who ended up with testicular cancer and actually passed from it at a very young. I think it's the same person you know.
Yeah.
Because you can buy dollar store pregnancy tests, and from my understanding is they're just as accurate as the expensive ones at the store, which we won't tell people that. But so is that something that a young man should ever do? Not necessarily as a complete check-in, but if you suspect, but is it something that's just reasonable to do every day?
Well, if the guy tests positive on a pregnancy test, go see the doctor because you probably got testicular cancer. But just because you test negative doesn't mean you don't.
Right.
Because like I said, there are so many types of cancers that don't release HCG, so you could have testicular cancer anyway.
What are the other symptoms of testicular cancer then? So if somebody, you're saying, if you don't suspect it, they probably wouldn't think to go get a pregnancy test.
Yeah.
If someone doesn't have, and again, it's not the catch-all, but is there a sign where maybe this is something you can do on a Saturday night before you see a doc on Monday and,
Well, the best thing you can do, actually, the doctors recommend is every so often do what men like to do anyway, and that's just kind of grope yourself and look for bumps and abnormal lumps and abnormal any growths at all down there.
So just like a breast exam.
Yeah, just like a breast exam, like anything else. And if you see something abnormal, sure, maybe pee on a test and see if you test positive. Either way, go see the doctor.
Gotcha.
Because that's going to really be the test is the doc. So if you do test positive, yes, you probably have cancer. If you don't, doesn't mean you don't.
Right. So now with positive pregnancy tests, I think we assume pregnancy means puberty, means teenage years or older. But we all know that the youngest pregnancy, documented pregnancy,
yes, was 5 years old, actually.
Which is incredible. I mean,
that is crazy to me.
Yeah.
Like,
it's my understanding that there was a medical condition.
Well, yeah, so she had, her name was Lena Medina. She was born in Ticrapo, Peru. And this was in 1933 when she was born. She gave birth to a baby boy by C-section in 1939.
Probably because, which is incredible to me then, 39 they were doing C-sections, but probably because of her size, the pelvic.
I would imagine,
you know, the birthing canal wouldn't have been anywhere near.
Well, yeah, she had something called precocious puberty. It's actually not uncommon, and that all that just means is that you have early onset of the hormones for puberty. And Lena actually started menstruating when she was 2.5, according to her mom. And then, according to the doctor who performed the C-section, she had fully developed breasts at age 5. So she was, for all intents and purposes, ready to give birth at that age. She actually never revealed who the father was, but at that time, the docs who did the C-section kind of did the interview and found out that in her particular tribe of Peru, they took a lot of medicinal things and had, I guess, lack of a better term, not seances, but what do you call those? Where you, like orgies, I guess. I don't know.
Yeah.
But they just took a lot of medicinal things, and then they had basically an orgy, and it
So
wasn't
their
uncommon
culture,
to have
these
rapes happen during that time, and she happened to be part of
Was
that.
she of average size height for a 5-year-old, or did
she was super-
present as a 12 or 13?
No, she looked. The picture I saw, and anybody can Google it online and see. She does hold the record, and she's actually only about the waist height of the doc that did the C-section. Actually, looking this up, you want to hear the saddest thing I've ever heard? I actually stopped reading it for a little while because I'm like, ugh, it's terrible. If you're born in South Africa today, you have a better chance of being raped than you do learning how to read.
I did read
Oh
Crazy.
gosh, that's incredible.
Don't like that.
No.
Anyways,
Well, I looked up.
downer.
Yeah.
Jeez.
Well,
on the
on that
opposite
note-
note, the youngest person got my mind spinning to, who's the oldest then?
Right.
So I found a woman in her 70s from India that gave birth after 2 years of IVF treatment.
I think I remember
Wow.
this in the news. Was this like within the last 5 or 10 years?
2016.
Okay, yeah, I
And
thought I remembered that. Yeah.
Did it say, do they do IVF treatment? Because normally
I
a
think
doctor
that
wouldn't
that's
want to.
not standard.
No.
Like, I think that that's not really ethical.
Right.
Yeah.
You know.
Right, and there was major controversy over that because they helped her for 2 years. It was her and her husband of 5 decades. He was 79.
Wow.
And they had no other children, correct?
No other
Yeah.
children, and she didn't want to adopt. So they are like convinced this is a gift from God and it's in His hands. And people who asked if they're are they worried about when they die, who's going to take care of their baby, and his response was, no, it's in God's hands, and I believe that because He got us pregnant, He will take care of and bless our child.
Wow.
Wow.
That's incredible. So how is she doing?
I
Postpartum,
didn't read follow up. I just read mostly just on that article itself. But I did find out that the clinic that helped her get pregnant puts her more at 72 versus 70, which she thinks, and it's because in India most people over 50 don't know their real age because they don't have birth certificates.
So what intrigues me about both of these cases is not so much their, the fact that they gave birth is, the anomalies, but I wonder how their bodies function after. So the gal that was 5, did she go on to have, did she have other problems from her condition? Did she have more children? Her early puberty, did she have normal menstruation and was able to have more children? Did she leave a normal life,
I don't know if I've read that she had more children. I know her son died super young.
Oh, he did?
Yeah, he died of a bone marrow disease at like
30?
40 something. Yeah, he died in 79, so he'd have been 40.
40.
Yeah.
Okay. But she did go on and get married and have another child.
Interesting.
Yeah. So the same, my question would be, I know how rough pregnancy was. I wasn't super young. I was in my 30s, and you just think about what it does to your body. So I would assume that a 70-year-old woman, 70 or older, there might be some, pretty bad damage.
Yeah.
Right?
You'd think.
Yeah, well, and osteoporosis is a problem,
Well, and that's a problem before you get pregnant,
At that age, a hip fracture from just, falling down, I can't imagine giving birth and
Right.
you know.
Yeah, and I would just, again, with the 5-year-old, was the baby born to term? Was a normal size?
He was born to term, and the doc performed the C-section, and there was nothing wrong. Healthy
That's
baby
incredible.
boy.
I
She
couldn't imagine a
went
5-year-old.
back to, and actually they didn't even tell the boy that he thought that was his sister growing up. They
Sure.
didn't tell him till later on in life that was his mom.
10, he found out
10?
because he was getting heckled at school.
Oh, you're kidding.
Mm-mm.
Because
Oh.
everybody in school knew and he didn't.
Apparently, it was like a big
Secret. Yeah.
That's like the poor kid.
condition.
Who's, yeah.
Condition.
Like the kid who's like everyone knows he's adopted but him, you know.
Yeah.
Oh,
Sucks.
sad.
And I'm laughing about it. But that's terrible.
Like Elf.
I
He
want to
doesn't
know.
know he's not an elf.
What's that conversation like between the 79-year-old and the 70-year-old? We're bored. We're retired. What else we got to do? Let's have a baby.
Yeah.
I mean,
Well, I think they'd been trying throughout their whole
Well,
for
sure.
50 years.
Yeah. It was their, I remember reading something on it saying that it was like their
Boy, it's
life's
like
goal.
Abraham in the Bible.
Yeah,
Right.
Goodness.
that's what I
Right.
thought.
We're all Bible readers. That's exciting.
Modern day, for sure. So,
All right. So I want to get back. Do we want to test this pee again? Seriously?
I don't have to go yet.
she wants to
Oh,
test it from
you
her
wanna
normal
test it.
I
straight.
want to
Straight
do
straight.
it like
Legit.
to the T, how you're supposed
Well,
to.
I'm just suggesting that if this looks another positive, April, once we wrap up filming today, you're going to
I'll
have
make
To
it
go to the doctor.
You're going to need
it's-
to go do some confirmation with Jess.
Because either way, it's an abnormal growth.
Right.
Baby or cancer. One of the two.
That actually could be a complete... Either way, we're going to have lots of more episodes to build off of, so it's
Great.
kind of exciting.
We might have
that-
to have a what happens during pregnancy episode. You'll probably notice our wardrobe change, hair changes.
Months later.
This is time-wise month later, and we're going to be talking about April coming up positive
On your pregnancy
on
test.
her pregnancy test.
And backstory, we had a camera that we now no longer use that was giving us a lot of problems with technical issues and stuff. So we had blurry and or cut off a good section. So the episode we're talking about is where we were testing her pee and pregnancy testing, and Scott and I had come up with a little dirty plan. I actually contacted one of my girlfriends who's pregnant, actually still currently pregnant, and had her pee in a cup. And then I went so far as to transport it home and to the studio, and we had it hidden kind of within the walls here. So when April wasn't aware, we switched out her pee cup with a pregnant female. And as the episode shows, April popped up positive during our episode.
How did you feel about that?
I just honestly thought, no, this must be a false positive. But then as you were like going through all the
That
sciences,
doesn't happen.
yeah, actually it's pretty accurate.
Because you were very quiet during that episode.
Oh yeah,
Yeah.
and wheels were turning, but all I was thinking is like, no, just be professional.
Did you at any point think that we had tricked you?
No,
Yeah, because
No.
we were so good. Like
We are so awesome
you
at
were
pranking.
awesome.
so good that you had no idea.
yeah,
that
not at all.
Yeah.
And so you were going on with, oh well, so either you're pregnant or you have cancer. So then I'm meddling through that, like, well, which one would be worse?
oh, that's horrible.
It is horrible.
Yeah, but
definitely
having more children is
pregnancy,
not on your
not on our plan.
Yeah.
God willing.
Yeah. So then
Ah.
I just think how really kind of mean that was of us, because I think when you have those events in life and you just kind of go in your own head, and you probably checked out and were not even paying attention to us anymore.
Well, you guys, I think were waiting for some sort of reaction, or for me to say, I need to go take another one real
Yeah.
quick. Like, stop. Because you guys kept on directing the attention on me, and
Yeah.
I'm like, no, let's just move on. Let's
you
talk
were.
about other things.
Yeah.
Well, and I will say, I think I laughed a little too hard at the fact you came up positive.
Yeah, you
'cause
kind of
that-
gave it away.
I did. I was super excited.
I had no clue.
You were in your
at
own
all.
head, and that's
Yeah.
what I was kind of looking for. Was when is she going to figure out that we're screwing with her?
Oh,
you
yeah.
know. So, and then after the show,
Oh, after the show, I ended up taking that fabulous tool of positive for pregnancy and used it to fool my husband.
and what was his reaction?
Well, he was so scared. 'cause
Yeah.
I had, poor guy. He was working, and all I texted him was, I'm on my way home and we need to talk.
See, that's scary, like, for a spouse. Like, that's not normal conversation, and that means that you want him to know that something's coming.
Yeah, so I knew it would work perfect. So I just said, well, our life's about to change. Either I have cancer or I'm pregnant.
He's like, I hate your podcast.
Say. He even cut a meeting short to hear this information.
How long did you let him suffer?
Oh, not very long, because he was silent. Like,
Yeah.
he was just looking at it, and all he said was, "What?"
What?
A couple times he said it, and I'm like waiting for him to ask a question, and he didn't. I'm like, he did. He's like, is this some sort of joke? But he said it in a way that he just couldn't process.
Oh.
And I said, yes, it's a joke. And it didn't even translate, really. And I had to say it a couple times, like, it's a effing joke. and he's like, oh.
So this is the middle part that we missed out on, the reaction and the explanation, and we wouldn't have had the answer about how your husband took it when you ran with the joke. So
yeah, he thinks it's funny now.
This is good-hearted, light humor, podcasting humor.
Good podcasting humor right there.
We're all friends. Took no offense.
So, well, good.
Awesome.
So thank you.
All right, you're welcome.
All the laughs.
We do what we can.
There you go. Now we're recording.
Okay. I'm not pregnant.
Great.
Nor do I have cancer.
Okay.
That I know of.
Negative and negative. So
The real test results, she's not pregnant and no cancer.
all right.
So thanks for tuning in. Now you know how pregnancy tests work and that it's really easy to get one over on your friends if you find some pregnant pee.
And I've actually heard there's a market for that. Like, I think you can buy it online, like pregnant pee, just like breast milk. Yeah. Luckily, I had some local
How do they
goods.
keep it fresh? Because like urine that's stayed around a while is
I don't
pretty.
know. But this is hand delivered. This is morning fresh right here.
Like a bakery.
Yes. We had your number,
her.
April.
Good for her.
Well, we're all done for today. And I guess if you like what you've seen or heard today, check out our website, YouTube, podcast.
At medicalconfessions.com.